have a van versus an articulated lorry, one male, heavily trapped.
Across the UK, elite helicopter teams are saving lives every day.
If I watch the obs, can you maintain visual with him?
Bringing the hospital to the roadside in a race against time.
Right, OK, don't look at that, mate. Look that way. Once I give him the drug, I want him out in 2 minutes, all right?
These are their stories.
15 minutes, man. Understood, thank you.
You just stay still and we're going to get you out.
That's it. Big release. Come and give me a kiss if you want.
She's been an absolute star and very, very brave.
All right, sweetheart.
Norwich International Airport. Home to the East Anglian Air Ambulance.
Blue mat bags in the front, black mat bags in the back. Behind the pilot, oxygen ×3.
On call 365 days a year as a mobile trauma unit, it covers a 70-mile radius from its Norwich base.
A colleague approached me and said, you know, you really should be flying. And I said, oh, you really don't want a small middle-aged woman in glasses? And he said, no, we really do. You're exactly what we want.
I've worked with Pam for quite a few years, and she's like your mum. Yeah, she's lovely. You know, I never feel like I'm working with someone and I'm the doctor and you're just a paramedic. It's one big team, and we work together to achieve the goal and get the best outcome for that patient.
Hello, Norwich. Tango Foxtrot. Search. RTC trapped. Crew request. Thank you. On the way.
The team have been asked to scramble to a road traffic accident 40 miles away, 20 minutes by air.
What are we going to, Carl? DLC, RTC?
RTC, person's trapped. Crew request on scene.
And if it's multiple persons, we might have a bit of triaging to do.
What makes people work inside? I think that was quite interesting when I was little.
The armoured pressure, 101.
I had this image of myself in a white coat with a stethoscope.
It's just what I wanted to do.
Okay, we've got traffic here stopped, both directions. Yeah. We've got the ambulance. Okay, got the guy with the Dayglow jacket in the field.
Anglia 1 overhead.
See, looks like carnage, Pam. Okay.
Anglia 1 on the ground.
Okay.
Hello! I've got a collision with an articulated lorry.
There are certain times that you're going into something when it is quite scary and your heart might start going a little bit. Clearly, there was quite a significant impact.
He's got 2 IV accesses.
Okay.
Had no pain relief at the moment. Is complaining of neck pain, but we haven't had a collar on him.
So no chest injury that you can identify?
That we're aware of.
We have a van versus an articulated lorry. One male, approximately 50 years old, heavily trapped. Unable to say at the moment whether he's major trauma positive or negative until we get to his lower limbs and pelvis. Anglia, one of them?
137.98. Exact 100% on air.
Okay.
What about some pain relief for him?
Okay, can I just work out what the plan is? Because he looks to me like he's not going to come out that easily, even once we've rolled the dashboard.
To be fair, there isn't much metal left around him.
Well, he's quite wants to be stable. I think we should roll the dashboard and see what we've got. Let's get him out.
He was bleeding from somewhere. He had injuries we hadn't even properly diagnosed yet. We needed to work out what was going on as soon as possible.
Carl, if I watch the obs, can you maintain visual with him? Thank you.
The pressure that's caused by the dashboard could actually have been stopping the patient from bleeding. Certainly there have been instances of patients bleeding to death at that point, just when the pressure's been removed.
But the team now face another challenge.
His leg to move, okay.
So if he's bleeding to death, we're not doing very well here, are we?
Steve needs ketamine, a powerful painkiller carried by the air ambulance, but it can affect a patient's ability to breathe.
Okay, if we give something, are we going to be able to then release him if we need to? Because we don't want to give him any ketamine if he's trapped. As soon as they're ramming, it's ramming onto his legs and he's in agony.
The thing I'm worried about is this is going to take... How long is this going to take?
Steve has been stuck in his vehicle for almost an hour. His chances of surviving extreme blood loss lessen with each passing minute.
What's just stopping it going forward?
He says they're ramming, the plastic is just
pushing
into his legs. So what they're going to try and do is get his spreaders in there and simultaneously move that plastic away while they're ramming it forward.
Yeah. Blood loss is a killer. There becomes a point where you just have to get them out.
Steve, this is going to hurt for about 5 minutes and we're going to... Yeah. No, but I just want to warn you, mate, because until we can get you out, we can give you some strong pain relief. So it's going to really hurt for about 5 minutes. Just bear with us and we'll give you something nice and strong to get rid of it, all right? Just grit your teeth, buddy.
The crew of Helimed 85 are attending the scene of a road traffic accident on the A10 in Norfolk.
So Steve has snapped his thigh bone and the bone was exposed. It's one of the strongest bones in your body, so the amount of force that it takes to break that is incredible.
We just need to get him out, mate. Just ram that forward and get him out. Just grit your teeth, Steve. 5 minutes, mate, we'll have you out.
Okay, Carl, it's good enough.
Okay, yeah, it's good enough.
Okay, Jake, stand back.
Stay there, Steve. That's what I mean. You got some pants on, bud? No, okay. Pain in here? Right, okay, don't look at that, mate. Look that way. Okay, so we've got open mid-shaft femur. He's now free. Okay. He's in a lot of pain. So, do you want to give him something, get a bit of ketamine, facilitate extrication?
I'm happy that he's stable.
Right, Steve, now that you're free, mate, we're going to give you a drug that's going to make you feel drowsy and you'll remember nothing about this, all right? Okay, guys, listen up.
Right, everybody listen, please.
The plan is I'm going to give him this drug, and once I give him the drug, I want him out in 2 minutes, all right? He will scream out, but he won't feel nothing. Is everybody clear? Yeah. Brilliant.
Ketamine is a horse tranquilizer. Good thing about that drug is that afterwards they will remember nothing about the whole incident. But it can be quite alarming to hear someone, after they've been given ketamine, to be screaming.
Steve? Yeah. You all right, mate?
Yeah, fine.
What?
Yeah.
You've had better days?
I've had a lot better days.
Where are you?
Sitting in a van.
Sitting in the van, mate, are you? All right. All right.
Okay,
yeah, let's go. Right.
It is going to hurt and he's going to shout.
He's going to scream, it's going to hurt, but you'll remember nothing afterwards. We ain't going to hurt you, mate. Don't you worry about that. Right.
Now, where am I?
Yeah, all right, mate.
Whoa, whoa, whoa.
Okay. Ready, set, and move. Let's get. Okay. If you can take a C-spine. Okay, keep going.
Oh, shit.
All right. Okay.
Ready, set, move.
Get the board up.
I'm on
right. You're not dying, mate. You got the board? Okay. Let's get the board out. There you go. All right. That way down when you come round, mate. Let's get... Okay. Right, I've got traction on the leg. Let's have the board out.
Crap, shit, come on.
You hold that leg and just keep hold of it there. Just keep pulling it. You got it?
Steve, hello.
Hello.
My name's Dr. Pam. I need you to take some nice... Steve.
Oh, hey, hello.
Does your chest hurt when I press on it?
Oh,
A bit, okay. Chest feels intact. What I suggest we do, we need a splint on that. I know, darling, I know. I'll give him some more ketamine in a sec. So it's empty negative, I think?
Yeah, I'll give the controller a ring a second. Okay, so give that ketamine a couple of minutes to work, Pam, and then we'll pull his leg, all right?
Yeah. Who has the oxygen? Can I have it back?
The main purpose is to pull the leg straight, and by doing this we reduce the blood loss and reduce the pain.
Okay. I think so, yes.
Am I swearing, aren't I?
No, you're not, darling.
How you doing, mate? The helicopter's coming in light without a patient. We're going to be coming to you by road. He's got an open mid-shaft femur. No other obvious injuries at the moment. He's had some ketamine, had some fentanyl.
Happy?
Right, I think we're there, mate. Let's just be off the scene within 5 minutes.
We need to go. You're absolutely right. I think you've broken your leg, mate.
Broken my leg?
Yeah. Not as bad as it first looked, though, so I think you might have got off fairly lightly, to be honest, looking at the front of your truck. Well done, everybody.
Good jump up. Thank you. Do you think we need to put any more traction on this, Pam?
Yes, I do.
Right.
Sorry, darling.
That's it. That's as good as it goes.
Sorry, I know, we're horrible. You're all right there, Steve. You're doing really well, mate. We're on our way to hospital now. I'm so sweaty, I can't get my gloves on now.
It's going to be a bit cold on your leg, mate.
My knee feels a bit squashy.
Yeah, I think it is a bit squashy, to be honest.
Oh, my bone was all stuck out my knee.
It was. But it's not anymore. Carl's put it straight. But I think it'll need an operation to put it completely straight.
Oh, dear.
It'll need a big pin in the middle of it.
Oh, dear, dear.
You all right there, mate? Yeah? We're about 2 minutes from the hospital now, all right?
2 minutes?
Yeah?
Oh, about 12 minutes.
I know, that's a woman's 5 minutes. Be about an hour.
It's a bit rude, isn't it, Steve?
Yeah.
Bloody rude, in my opinion.
A woman's I'll be ready in 5 minutes is the same as man's I'll be home in 5
I get
minutes.
ready more quickly than my husband. Okay, yeah, we're good.
We're going to pump up.
This is 4, please.
Hello, Angelo.
Angelo,
He's nice and stable. We can get him over if you're happy.
ready, set, and lift.
Yeah.
Okay, this is Steve, is a 55-year-old gentleman driving a white van involved in a head-on collision with an articulated lorry. This is bleeding quite significantly. He's had 40 of ketamine to extricate him and 100 micrograms of fentanyl, which will be about 30 minutes ago now. He's been cardiovascular stable at all times.
Okay. Thanks, Angelo. Thank you.
It is always a relief to feel you're in the place of definitive care and people have heard the important things that you said.
I'll just go and do the paperwork.
Steve will be prepared for surgery to repair his leg. Even if successful, it could take years to recover fully.
Now, what's your trick for doing this easily?
Right, so
Pull your handle.
put it in as normal.
Yeah.
That's where it gets stuck, isn't
Yeah.
it? Stand on the step.
Oh, and just lift a bit, okay.
There's no point in us getting involved, Pam, is there?
No.
When we're flying back from a job, that's the time we can relax and just enjoy a bit of relaxing downtime.
Andy 1, lifted from Kingston and returning to base. Thanks. Do you want the biscuits up front?
I'm fine, thanks, Pam. A nice day for flying.
The Eden Valley, Cumbria, home to Helimed 58 and the Great North Air Ambulance's Penrith site.
I normally do about 1 shift per month at Penrith. You know, we've got cows in the fields and the hustle and bustle of the city, you know, that just doesn't exist there, so it's nice. Especially working with Stuart. I've never seen Stuart stressed.
I've been working with Megan for about 3 years now. We may not look like the dynamic duo, but we're ready for anything.
Hello, Teesside Air, that's Andy speaking. No problem, and Mountain Rescue are going as well. Okay, tell him at 5-8 on the way.
A report has come in of a hill walker with a suspected stroke 30 miles away. A 40-minute flight for Helimed 58.
There's a 3-hour window to get the patient into hospital so we can give drugs to reverse the effects of the stroke.
Lake District is a beautiful place to fly over, but can be one of the most dangerous.
Oh, I might get a bit bumpy in a few seconds. Yeah, looks like it's getting a bit dark.
It's flying into a valley, so we have the ridges on either side of the aircraft. You get turbulent air coming from different directions.
Somewhere low 10 o'clock now. Underneath us now, low. Yes, so Lake House, about 300 metres.
The location is now directly below them. But even experienced pilots like Owen can find landing in these kinds of conditions challenging.
The issues with this place then is the wind's coming actually from the old Maniconiston towards the village itself. So I've been downdrafting there, be a bit bumpy. But we'll suck it and see what it's like.
When you know someone on the ground needs your help, it does drive you on a little bit, but you can't really risk your life to save a life.
A little bit of a downdraft there. Get the SP back on and fly away from this.
The turbulent weather is making it impossible to land safely. The team need a plan B.
Mate, can you go over there, Mark, can you? Perfect, yeah. But if they're there, they can drive them down towards you. Might as well back at the bottom. Yeah, kind of submit Element 58. We have made a couple of approaches to landing sites, but are getting buffeted by the wind. Just wondering if we can land somewhere in Coniston itself. Roger.
Hiya, how are you doing? Nice to meet you. Each here with you about 7 minutes. The quicker we can get that oxygen supply to the brain re-established, the better the patient will do long term. Every minute counts. Hiya, how are you doing? I'm Mike, I'm on the doctors. What was his name? John. Hello, John. John, can you hear me? I'm just going to press on your eye. Did he complain of any pain or in his chest or anything like that?
People say when be active, but they're small, about 2 millimetres.
How long was it? Before when he was just not quite right to when he became like this? How long?
Well, he wasn't quite right from, say, lunchtime. It might have been about 1:15.
Right.
So when we got here and then we suddenly realised there was something wrong. He had this bit just 5 minutes ago.
You need to with your RSI him, to be honest, Stu. Yeah, he's pretty much extending. I'm thinking John has either had a blood vessel in his brain that's burst or he's had a stroke. Both need urgent medical attention. His brain is critically ill. See how his arms are just moving in this funny way? I just wonder if he is going to have another fit. To see a husband like that, pretty sure she thought he was dying.
The crew of Helimed 58 are attending a call-out in the remote location of Coniston. John has collapsed with a suspected stroke while out hill walking with his wife, Viv.
As soon as I arrived, I knew we were serious. In situations like these, we've got to work calm, methodically. There's a lot to accomplish, but I don't want to worry his wife. Stu, it's just about a fit. Could I get some midazolam? Let's have a tourniquet. All this means is if he has another fit, I can give him some medicine to stop it, all right? So what we're going to do now is we're just going to get him outside, okay, and then we can get him in the back of the vehicle, then we can get him down to the helicopter where I can do a bit more. Okay. I decided to do a rapid sequence induction, or an RSI, which is an emergency general anaesthetic, in order to control his breathing, his oxygen and carbon dioxide levels. I need to get John down to the helicopter to do it. Thanks very much, lads. You got it? How are you doing, Stu? Right, we'll use the green line for the RSI. The one problem that might stop me getting the tube in is if the sun comes out, and the darker it is, the easier it is for me. So what we're going to do, we're going to start this in the next minute or so. All right. It's all or nothing. You're going to give drugs, and those drugs are going to cause your patient to stop breathing. I'll just have a look first. You've got 30 seconds or so to get that tube between the vocal cords and stop breathing for them, or they're going to deteriorate. Yeah, I could do with that.
Yeah, shake guidelines.
Okay, can I have the bougie?
Tube is going on. Tube's on after the bougie. Happy? Wait a minute.
It's a big gamble,
Yeah.
but the gamble's with their life.
Cuffs up.
Okay. It's not very difficult to see that, actually. So great, our arms are looking good, so we'll get moving in the next couple of minutes just because I think the rain's going to come in, so...
Feet first, please.
We'll get him in and then I'll bring that across, okay? Right, fellas, that's an awesome job. Well done.
We've got a male in his 50s that's become unwell whilst walking. He's then deteriorated to GCS3. No, I think they're suspecting he might need neurosurgery. He'll be with you in 22 minutes.
We are on route to James Cook. It is 17:15. That's 23 minutes. Yeah, cheers. That's not running properly. I've got any birds. I can't get another line in them. It's not going to be easy to get this.
It's tough looking after someone in the back of a helicopter. It's cramped, there's a lot of vibration, so it can be quite a challenge.
I wonder if you've had an MI or something. It's short. Ian, how long have we got left to run? 11 minutes. I'll do that just back a wee bit faster, we'll just switch it down. Is his tube moved? Yeah, it might have slipped a bit. Not a good trace like in a minute.
John is showing dangerously high levels of carbon dioxide in his body as the team struggle to maintain his breathing.
Do a bit of morphine as well, that complements his blood pressure. Alright, as long as your harness is locked and tight. Just having a bit of a fight with him in a minute. No worries, mate, so you guys crack on there now, I'll continue. All of it. Aye, keep on lying.
One, two, three. All the way. It's an incredible relief to step down on the tarmac.
I know I'm at my hospital, and I know I can hand him over to my colleagues and the patient's still alive. Right, so this is John. He's 60. He was up the Old Man at Coniston, felt unwell, kind of lost his speech and then collapsed about 1500. My diagnosis is either he's had a big CVA or he's had a bleed. Sorry, he's a grade 3. He was a difficult. Yeah.
John will undergo tests over the next few hours to determine the cause of his collapse.
Cheers, see you later. We do some tough jobs in some very tough situations. It's a privilege to look after these people.
Runway northbound 2. Anyone lived in at 240?
170 miles southeast lies the headquarters of the East Anglian Air Ambulance.
Okay then, so, 2 times life jackets.
Yeah, check.
Cling film ×1.
Hungarian doctor Ákos Soti has been working for the charity for just over 2 years.
Yeah, my nickname is Shit Magnet, so...
It's definitely true. When you realise you're working with Ákos, you're in for a rough ride, you know you are.
We'll see. You never know.
Hello, Norwich. Tango Golf 525-122. Cheers, buddy. Thank you. Bye.
Helimed 85 has been requested to attend an incident at Caister-on-Sea, a 12-minute flight from their base.
The neck of femur fracture is part of the hip. It's basically the old person's break. It can easily happen.
Okay. Right, let's have a look. Where can we go? Oh, God. I can land on that waste ground. We should get you out to the road behind the building. I'm 99% sure there's a gate, so it should be alright. Alright, I'm going in this time. Wind's behind us at the moment. And I'll go on that little car park. Good look out for wires, everyone, please. Left looks good, underneath looks good. Yeah, all good out to the right. Now I go down there. There underneath, clear. Okay, got it. That's...
Hi everyone, I am Ákos.
Hello there. This is Marjorie.
Hi Marjorie.
Marjorie's 95, querying. We're querying mid-shaft femur.
Okay.
She's had 10 of morphine, had a gram of paracetamol, she's been supplementing Internox as and when.
And still in pain.
Still no improvement.
Okay, and it was an accident.
It's just one of those things that happened.
Okay.
Don't know what happened.
The ground crew had given all the pain relief they were able to give, and they were still struggling with her pain.
Are you allergic to anything? Any medication?
She's deaf.
So, okay, sorry. Are you allergic to anything? Any medication?
No.
No.
As far as I know, because don't take much.
All right. Okay, when was your last meal?
Me really haven't had a meal 44. All day. I've just had a snack, which I was going to have a proper meal now.
Oh, okay.
Are you happy to sedate on that?
Yes. Yes.
Ketamine we carry is a brilliant drug, but it has its own risks, and especially at her age, we have to be very cautious.
Okay, so where is the pain?
It's all in here.
It's all in here. Okay. So what we're gonna do, going to give you some very strong pain relief and make you a bit sleepy. And by that time, we are going to straighten your leg. Probably will be asleep and won't remember anything, okay? That's our plan. All right.
And my daughter all that.
Okay.
Akos can resolve Marjorie's pain, but there is one potential problem which even he cannot control.
So this is the drug we were talking about. Okay. Emil may feel a bit sleepy. Okay, I gave 35.
Beautiful. I'll have that.
Okay. Marjorie, are you with us? Not anymore. She has fallen asleep. Okay, so the leg is yours, Rod. Let's go for a nice and slow.
Hello, Marjorie.
Thank you.
Okay. She won't be aware of it. She'll make some noise.
No,
She won't.
Yeah. Okay, go for it.
Lots of quarters.
Margaret, are you with us? Open your eyes, look at me.
Marjorie.
Okay. No, she's not with us. All right, so let's move because the ketamine is going to wear off shortly.
Some of these realignments can take a lot of pulling and pressure to get them back into place, and other people can just change their positioning or will just move them slightly.
Stop. Oh, there, that's gone back into place. Good.
And that is exactly what happened in Marjorie's situation.
Something just really popped back into place, to be honest with you, but it's still external rotation.
All of us are fine. Marjorie, can you hear me?
Yeah.
Yes, all right, just stay relaxed, okay? Yeah, all right, let's move. Let's get some cover.
Yes.
Marjorie, we are here with you.
I'm with you, Mum.
If you have any problems, just shout out, and we are here to help, okay? Okay. Good.
Being sick isn't very dignified. I try to reassure it's not a big deal for us. We see it each day.
You all right?
I think so.
Okay.
Sorry.
So, no, that's no problem. It's mainly the side effect of the morphine you got from the ambulance, okay? So never mind. It's not your fault. It's nothing.
An experience like this can really scary for a patient. Holding someone's hand, it can be as important as the medications we gave.
Marjorie will go straight to theatre for surgery on her leg.
I don't know how things will break up for Marjorie. The older you get, the harder it is to recover. I hope the outcome will be good for her.
Tees Valley Airport, headquarters of the Great North Air Ambulance. Manning the control desk today is paramedic Andy Mawson.
Teesside Air Desk. Whereabouts, sorry? Can you give me a grid, please? 853. Brilliant. Okay, mate. But they are on their way. Probably take them about 15 minutes from now. Great stuff.
Dr. Mike Davison and the team of Helimed 58 are off again, this time to the rural area of Ulverston.
It's a crew request a guy kicked by a horse with ribs and through outdoor.
As soon as I hear the word horse, I know there could be some serious injuries.
Whereabouts? Winston? Botmender Coniston. Eyes off on model over cloud, 10,000 feet. We'll find out exactly. When you look out the window and you can't see anything, you're in cloud, you know there's mountains around. I can't concentrate on instrument flying when I've got a doctor crying in the back.
I hate flying. I think it's just lack of control. I still can't work out how I ended up doing what I do today.
Not a vehicle actually, 12 o'clock. Ah yes, seen. Right, I don't like landing in the paddocks because they're always a bit dusty, so one of those two fields. Right, my seat over this fence now. Good.
I'm in the army. I'm a colonel in the Royal Army Medical Corps. Obviously, you're in different environments, jungle, deserts. You've got some bullets and bombs chucked in your general direction, so I enjoy that. I like the challenge of that.
You're just in the ambulance, are they? All right.
I think now, if someone tried to take away the air ambulance work, there'd be a massive hole in my life.
Hiya, good morning. Hi, I'm Mike from the Great North Air Ambulance. What's happened?
Right, this is Mark, 40 years old.
Have you been walking or anything since this happened?
No, I stayed down.
Have you? Right.
I think I'm fairly tough.
Where did he get you? In that area there. If I press between the front and the back there, does that hurt you at the side?
A little bit, yeah.
Good man, just kind of medium-sized bits.
Mark has a young horse. It's been injured and it's on walking work, and he was walking around the menage with it, and then it reared up and bucked and kicked him with its back legs. Mark actually catapulted to the floor, and then he couldn't get up. It's one of those things.
Let's have a little feel above your collarbone.
Okay, up there.
Yeah, it's just sometimes if you just nick your lung, you'll find a little sign up there, but that's all normal. So your belly here, blow it out so it's big and fat. It touches my hand. That hurts you. Yeah.
Yeah.
Just suck it in now so it's skinny.
Okay.
That hurts you across here. Okay. How far is it by land?
To Preston?
Yeah.
For about hour and a half, something like that. Yeah.
Well,
So it's up to you guys.
On the off chance if you did have a problem, your spleen lies just underneath there, but you can't tell for certain without a CT scan. Now we could take you to a normal A&E department, but if there was a problem with it, the trauma centre at Preston, that's far. They've got surgeons and specialists that are trained in this area, so your care would be better.
Internal bleeding from a ruptured spleen can cause death in a matter of hours. Mike is taking no chances.
If he did deteriorate, I've got blood and blood-clotting drugs on board. It's a no-brainer. We've got to fly him.
Now you get better, Mark. You've got a wedding to go to next week.
I've got horses to shoot tomorrow.
Well, don't worry about that now, mate.
Yeah. This is his fiancée. He'll be fine. He'll be dancing on that dance floor.
Keep up, that's it, and slide in now, that's it.
Yeah, perfect.
We're off to Jamaica honeymooning.
Your feet are a wee bit tight, just going to do your blood pressure, alright?
A drop in blood pressure can be a sign that he's bleeding internally from his spleen.
What's your name? Mark. Hiya Mark, I'm Alison. Welcome to Bow Preston.
Mark will now have a CT scan to check if he has damaged his spleen.
You're spot on pulse-wise. You never budged. About 70 to 74. Blood pressure was 140. He gets married in a week, so he needs to be fit for that, fit for a few beers.
Mate, this is going to hurt for about 5 minutes and we're going to... Yeah.
Police have this phrase, life-changing injuries, and that sums it up perfectly, actually. Lives can be dramatically and suddenly changed.
One of those things that happened.
Okay.
Don't know what happened.
And you weren't back on the ground at Norwich Airport, over.
Now you get better, Mark. You've got a wedding to go to next week.
I wasn't aware of how dangerous it was to rupture my spleen. For 24 hours it was touch and go, whether the surgeons went in and removed it.
Yeah, I was slightly concerned that Matt wouldn't make the wedding, but luckily he came out in time to waddle down the aisle and we had a lovely day. Luckily, everything's worked out fine. We've got our daughter Lily here now, and married life's good.
We're going to start this in the next minute or so, all right? It's the most severe growth rate there is, which was a bit of a shock at the time. It might be a year or it might be 10 years, depending, because everybody reacts differently. The best thing to do is to enjoy the current day and not worry too much about the days that are coming thereafter. Needless to say, I was able to make a bit of a donation, and I would also encourage anybody else to make a donation to these organisations. I'm still alive and able to get some of the things sorted out. You know, for my dear wife, who has been an absolute angel throughout all of this.
I don't think there's any other real jobs that you're constantly reminded of the fragility of life. Life can change in seconds, and we see that. As I say, always make the most of what you've got.